Good morning, everyone. Welcome to Center of Balance Live. My name is Kini, the acupuncturist and Chinese medicine practitioner from Center of Balance. Before I start, I would like to give a big thank you shout out to those who continue to support us and continue to share our daily life, and those who subscribe to our YouTube channels. I hope you guys can continue to share our daily life topic to those who is in need, and help us to reach out to those who might not yet to know us but could benefit from our DIY acupressure points. Today's topic is about edema and which acupressure points could be helpful for this type of condition. Please drop me a message, say hi, send me some positive vibes, give us a like, and please definitely share this video or tag those who will benefit from our daily life. So, do you know anyone who suffer from edema? If you do, please reply 1 or a big yes, and definitely tag him or her. Right, let's get one of these 3 tools ready as usual, and it could be your finger, so it can be your thumb, index finger or middle finger. Number 2 will be your knuckle, where you bend your index finger down and with your thumb underneath to support it. Number 3 will be a massage device or some small rounded tool, not sharp, please. What is edema? Edema is a fluid retention or accumulation that occurs when there is too much fluid, mainly water, that overflows into interstitial tissues in the muscles and skins, causing the puffy swelling to occur in the affected area. It can be around hands, face, eyelids, feet, legs, ankle, trunk, or even the entire body. This swelling is usually related to venous vein system or lymphatic system, which is the tube that carries the lymph fluid that helps to fight infection and clear fluid. What causes edema? So, in pregnancy, edema can be very common because the fluid volume increases. There are many different kinds and causes of edema, and it's often a symptom of another condition. So factors or other illnesses that can be with certain medications, severe protein malnutrition, chronic venous insufficiency, sleep apnea. You have prior lymph node resections, different organs problems such as heart, liver or kidney, thyroid disorder, blood clots, infections, severe allergy reactions, certain cancer, and of course there's certain chemotherapy treatment. Got to pay attention if the edema is rapidly developing, and because it can indicate a serious condition, so which require the urgent medical attention. Okay. How is edema treated, or even temporarily? Edema can often be improved if reduce your salt intake, eat a wide variety of healthy food. We usually recommend vegan. Avoid packaged or processed food that are high in salt. Getting a moderate amount of exercise, which can prevent the swelling due to inactivities. Avoid tobacco and alcohol. And try acupressure, or even better, with Chinese herbs and acupuncture. So it is important you visit your doctor or a traditional Chinese medicine practitioner to identify the cause of your edema so it can be treated properly. Would you guys like to have a guess? What are the acupoints? So please don't forget to like and share or tag the people that can benefit from this video. Number 1 point, on the interior aspect of your lower leg. 4 fingers below your kneecap, 1 finger breadth from the interior crest of tibia. So it's on the front of the knee, it's on the lateral side. So if you find the bottom of your kneecap, the bone, put 4 fingers there, and then on the side here, there's a bone. Just put 1 finger right next to the bone. That would be your point. So within that region, you palpate around there. So 4 fingers down from the kneecap, and 1 finger breadth away from 1 finger breadth away from it, from the bone. Okay. Move on to the next point, which is on the medial side of the lower leg. It's in the depression behind and below the medial condyle of the tibia. Basically is your knee. Okay, the easiest way to run, if you run your thumb up the edge of the bone on the inside of your lower leg until it falls into a depression, just turning the corner here, just turning before the knee, just below the knee. You can go into a depression, or you can find a very tender spot. You palpate within that region, and you find the most sensitive spot to apply firm circular pressure up to 30 seconds. And pause and repeat again up to 3 times. Next one is the acupoints that sit in the web of the skin between your thumb and the index finger. That's the highest point of the muscle. So basically, you just crunch your eyelid so you can see the highest point. There's this bump here. Then that's your point. Okay? Or simply, you just do this where this thumb named, then that will be your point. Within the area again, find the most sensitive spot and apply firm circular pressure or massage for 30 to 60 seconds. The 4th point is you measure 3 finger length down from the wrist crease. Okay, 3 fingers, and right between the 2 tendons, or right under the index finger. Okay, in this case, it's my ring finger. Okay, right underneath it. You palpate around there between the tendon. You locate the most sensitive spot there. You can press on in a circular firm motion for 30 seconds, please. And you pause and you restart again. Be aware though, it can be quite sensitive around this area here because there's nerve there, and it will trigger an electric shock, can go all the way up to your middle finger. But don't panic. Just don't press too hard, please. And the last one will be on your tummy. You find your belly button. Your belly button, you place 1 thumb there, and it's just above that belly button. Your thumb up above the belly button. Okay, this is 1 tune. So you just place on your belly button. Okay, you place it at the edge of this. You'll find a point there, quite sensitive around there too, so just palpate around there. So just above the belly button, place 1 finger there, your thumb, and just above it. Okay, so just above here. Within the area, just give a firm circular motion massage up to 30 to 60 seconds. Okay. Or if you have the magical heating pad, wheat bag, or hot water bottle, you know, place it on your tummy for 15 to 30 minutes at least once per day. You can also place the wheat bag on your lower back region for about 15 to 60 seconds. Okay, so lower back region here. Okay, so it will be the tummy, and or you can place it on the lower back here. Okay, just the lower back here for 15 to 30 minutes every day. Okay, as long as it's not uncomfortable. So but don't leave it on for too long, as you can damage your skin from overuse, okay, or too hot. Please do these acupoints every day, or at least once per day. Of course, these points might not work for some of you. This is because, according to Chinese medicine, this kind of abnormal excess water in the body could be a result of failure of lung, spleen, and kidney in their function of transforming, transporting, and even distribution of water or fluids. And because according to Chinese medicine, kidney is the root, the lung is the appearance, and the transportation and transformation function of the spleen, and the gate controlling function of the kidney. And then the Sanjiao loses its ability to regulate water, and as well as we all need that qi to move, to form, to transport them. When all these organs fail in their function, it overflows the normal channels into the skin and muscle and produce edema, and this is according to Chinese medicine. Chinese medicine and acupuncture can effectively treat different types of edema conditions, but we will have to ask you a series of questions in order to assess which type of edema you have and the organ system that are affected or out of balance. So please call us or email us info@balancetcm.co.nz to book an appointment. It is necessary for us to do an initial examination, or very important for us to do an initial examination to correctly diagnose your condition according to Chinese medicine. And then we come up with a treatment plan and points, and even prescribe Chinese herbs for you. So please also check out our website www.balancetcm.co.nz. We have 3 clinics in 3 different places: Hamilton, Raglan, and Auckland. But if you are outside of New Zealand, don't worry. As long as you have internet access, we do offer online Zoom consultation, simply because we just love what we do, and that is to help you. So my name is Kenny. That is all from today. If you like or enjoy our daily life, please give us a thumbs up, like and share. Thank you for joining us today. Looking forward to seeing you guys again. Love you all. You stay awesome, stay positive. Ka kite anō.